today we are going to learn about a very important topic, blood pressure, and we learn about the risk factors and how to control it. So blood pressure, everyone would realize, is a very important factor, and these days in younger population we are seeing lots of young patients having blood pressure. And earlier, when we used to see patients, it was only the older population which used to have blood pressure, and that was related to stiffness of the arteries and narrowing of the artery. However, nowadays, younger population gets blood pressure due to many reasons. It could be related to the family history. It also can be genetic. It can be due to lack of exercise, excessive intake of salt, and a lifestyle which is not okay, and also taking certain foods which decrease the metabolism, and there is inactivity which is causing all this kind of a problem. Also, one of the major factors these days is stress, which leads to high blood pressure. Now, when we talk about the signs and symptoms of blood pressure, it could be just not anything. So it's very important that people come forward and get the check done for a routine checkup, so that we can take care of the complications which are associated with high blood pressure. So since the symptoms are bare minimum, it is also called silent disease. However, few patients may have problems when the blood pressure goes very high. It may be related to high headache which is happening. It could also lead to tiredness, fatigue, pain in the eyes, some tingling in the ear, nausea and vomiting, which are basically associated with symptoms of high blood pressure. So a simple instrument, which is a BP instrument, which is available. It can be also be measured at home, but the best is that the patient need to come to a doctor so that we can check that, and in case it's high, then it is rechecked, so that we are not treating the blood pressure which is related to the stress. It is also called white coat hypertension, where the patient gets stress when they see a doctor. So blood pressure should always be taken in a calm place when the patient is relaxed and the patient is sitting for a little while. A normal healthy blood pressure is considered something between 120 and 80. 120 is the upper, which is also called systolic, and 80 is the diastolic, which is the lower blood pressure. So there are medicines to be taken in case the blood pressure goes high, and we need to achieve a target where blood pressure is somewhere between 130 to 90. It's below 130 to 90. Now, when you talk about the preventive steps, the most important of them is regular exercise. A patient should be exercising almost every day, but nowadays, even if you can exercise 150 minutes per week, that is considered a good exercise, provided that is an aerobic exercise. And aerobic exercise is something where the heart rate goes high when you are exercising. It should be at least 1 to 1.5 times high. One should always indulge in a healthy diet, which includes taking less fatty meals, less salt, less of saturated food which is there. Also, regular monitoring of blood pressure is very important, and management of stress, which can be done by the way of yoga and meditation. Then one need to adhere to the medicines, which is also very important. Here I should also mention the role of smoking and alcohol, which is very important, and it's been found that the smoking increases the blood pressure tremendously. So patients need to be giving up smoking and consume a diet which contains low salt, more green leafy vegetables, And there's also a special diet called DASH diet, which is rich in the potassium, and it is thought to be little preventive when we talk about the blood pressure. Beyond that, a regular intake of medicine is something which cannot be discounted for any patient. Patients who have got very high blood pressure can also add salt at the table as they add tea to the sugar. So the same way, you need to make the food without the salt, and on the table when the food is served, the salt can be added. So these are the major things which the patient need to take care of, especially if the blood pressure is very high. Thank you so much.